Thank you. So in Parliament today was tabled the Joint Committee report looking at medical assistance in dying where mental illness is the sole underlying condition. We've been following the committee's work very closely, Arif and I, and are deeply appreciative of the time that they've taken. I can say that we at the same time have been doing our own engagement with stakeholders and with provinces and territories. And can say that we agree with the conclusion that the committee has come to, that the system is at this time not ready and more time is required. We will be tabling a parliamentary response in the coming days. We're not in a position right now to exactly say when, but we can say it will be very soon. I can say that this is an alignment. You've seen public statements from the provinces of Alberta, Saskatchewan, Manitoba, and Quebec indicating that they're not ready. This is in comportment with the Joint Committee's report and, frankly, with other conversations that I've been having with health ministers across the country and with the Canadian Mental Health Association and with CAMH. But happy to take any questions folks may have. I don't know, Arif, do you have a comment? Okay. Yeah.
What are you going to be doing about the fact that...
Would you mind just to repeat the decision you just made in French, please?
Oui, absolument. Je m'excuse pour ça. Alors, j'apprécie beaucoup le travail du comité sur les questions de l'aide médicale à mourir quand les conditions est seulement une maladie mentale. Et c'est clair dans leurs recommandations, mais aussi dans mon conversation avec mon homologue dans des provinces et territoires, que notre système n'était pas prêt à ce moment-là. On va présenter le projet de loi bientôt avec notre plan.
C'est quoi ce plan? Est-ce que c'est de repousser l'aide médicale à mourir? Il était question d'une période de temps. Est-ce que c'est ce que vous comptez faire, M. Virani ou M. Holland?
Oui, c'est vraiment une question de... c'est pas une question de si, c'est une question de quand, mais on a besoin plus de temps parce que le système n'était pas prêt à ce moment pour continuer.
So will you be moving forward on March 17th?
Sorry?
So will you be moving forward with this on March 17th?
So, look, the legislative time frame is tight. We recognize that. This has to be done in advance of the 17th. I would point out that both the Senate and the House conducted its work as a committee, so the committee work has effectively already concluded on this. So I don't see the timeline being a barrier, but we do need to move expeditiously.
What exactly are we moving on? Like, what do you mean by parliamentary response? Are you going to legislate another delay? And if so, like, what's the time frame for that delay?
Well, again, they are the plan that we'll be presenting before Parliament, and I can't speak until we introduce that plan on the specifics of length of time, but we are saying that we agree with the Joint Committee's conclusion that more time is required, and we'll be in a position in the coming days to talk about how much time we believe is required.
Monsieur Virani, est-ce que vous avez une idée, vous, de ce délai? Est-ce que ça peut être 1, 2, il y a été question de 3 ans également, là?
On n'est pas en mesure de vous provisionner ce détail-là parce qu'à cause du privilège parlementaire, ce qu'on peut vous dire, c'est ce que le ministre Holland vient de dire, c'est qu'effectivement, on va provisionner une réponse au niveau parlementaire dans les prochains jours.
Donc, on apprendra plus tard cette semaine ce délai-là, c'est ça?
Dans les prochains jours. Parce qu'il y a une date prescrite, disons le 17 mars, donc il faut nous dépêcher.
En anglais, s'il vous plaît.
It's not possible for us to provide you with details at this point with respect to the parliamentary response. Minister Holland has indicated that we will be providing a parliamentary response in the coming days. We understand the necessity of acting quickly because of the date that is currently prescribed in the legislation, which is the 17th of March. And as Minister Holland indicated, we're very aware of that date and we intend on meeting that deadline in terms of our response.
But you can't say whether or not... I understand there's sensitivities and whatnot, but you can't say whether Canada's going to move forward with this or not?
Well, let me be very clear. We need more time. And I think I'll be clear on a second point, which is that on the question of whether or not there's equivalency between mental and physical suffering, I don't think there's any question that there is equivalency. The question here is one of readiness, and I can speak to the conversations that I've had with provinces and territories, with experts in the field. Although the curriculum is present, although the guidelines are set, there has not been enough time for people to be trained on them, and provinces and territories are saying their systems are not ready and need more time. Now, in terms of how much more time, as Minister Virani has said, we are going to be tabling legislation imminently, and once we table that legislation, we'll be in a position to talk exactly about timelines. But until we table that legislation, we cannot give exact timelines.
So is your intention to still move ahead with MAID for mental illness, just within a longer time frame?
That's correct. I mean, the issue here is, again, not whether or not somebody, look, we're talking about, there are people who have for decades been trapped in mental torture, being in a horrific situation where they have tried everything and exhausted all avenues, and under their own recognizance are saying that they want access to MAID. What we're saying is that in order for somebody in that intractable situation who is in a mental health nightmare, that, you know, after trying absolutely everything, that eventually they should have that right. But the system needs to be ready, and we need to get it right. And it's clear from the conversations we have that the system is at this time not ready and therefore need more time.
Was it irresponsible of you, though, to pass this legislation when you now know that the system is not ready for it?
Well, absolutely not. I think this is a hard conversation. You know, when you look at the people who are suffering and who are asking for this relief, we take that deeply seriously. I think the question, though, is making sure before we move forward, and the date is on March 17th, to really ascertain and understand, you know, is the system ready, and to get it right. And I can tell you, when I became health minister 6 months ago, the experts I was speaking to were saying the system was ready. But as we probed that more deeply, and as we had deeper conversations around the level of training, how many health professionals had been trained to the curriculum that was there, the adherence to that curriculum, it became clear, talking to provinces, territories, CAMH, the Canadian Mental Health Association, and others, that we aren't there yet. And so we're taking the appropriate measure of taking another pause.
Can I just add on that point? So what we've always tried to do with respect to medical assistance in dying since 2016 is always calibrate two fundamental ideas: the autonomy of the individual in terms of dignified decisions about the timing of their own passing, coupled with protecting vulnerable communities, vulnerable individuals. That's the balance we've always tried to strike. With respect to your specific question, what I would say to you is that clearly what the legislation we've enacted thus far has done is it has spurred the healthcare system and the health professions to come up with a response. So we've got curriculum that's now been set. But what Mr. Holland is articulating is that we need the take-up of that curriculum. We need the take-up of that training. What we've heard loud and clear, what that committee heard loud and clear, for a second time no less, is that those healthcare system actors are not ready. And we need to be attentive to that.
Est-ce que vous craignez quand même que ce soit contesté, votre décision d'encore repousser cette décision-là de l'offrir, la médicale à mourir, aux gens qui souffrent de santé mentale? Est-ce que vous ne craignez pas que ce soit rapidement contesté? Là? Il y a des gens qui se préparent là, déjà à le faire.
Donc je ne suis pas ici devant vous pour effectivement avancer une litige ou non, ou de commenter sur une litige, quoi que ce soit, si une litige dans l'avenir ou une litige comme... Effectivement, il y a toujours un aspect du litige dans ce contexte-là. Vous savez qu'il y avait une décision Carter, ensuite il y avait une décision Truchon. Donc le litige est toujours dans le contexte où on traite le dossier en complète. Mais ce que je peux vous dire, c'est qu'effectivement, on est en train de toujours équilibrer le système où on provisionne une autonomie, une dignité pour l'individuel, et aussi on fait la protection pour les peuples vulnérables. C'est ça l'équilibre qu'on a toujours essayé d'équilibrer. On va toujours essayer d'avancer avec ce thème-là, mais je ne veux pas d'aborder mes sentiments légaux sur le sujet ou sur une contestation.
À quel point le manque de consensus social a joué dans cette décision-là?
Oui, c'est difficile, parce que il va y avoir jamais une situation où il y a un consensus total. Mais pour moi, est-ce qu'il y a des grandes majorités d'opinions raisonnables dit que le système est prêt. Et certainement, pour les provinces et les territoires, c'est essentiel que les provinces va dire que leurs systèmes sont prêts pour le changement. Et ce n'est pas le cas aujourd'hui. Et ça, c'est la raison pour laquelle on doit continuer de travailler avec les provinces et les territoires, parce que les provinces et les territoires sont responsables pour le système de santé. Et leur opinion est absolument essentielle dans le processus.
Definite delay on the table.
Look, I appreciate that you want to get to the legislation. It's coming soon. I'm not in a position to be able to talk about what's in it.
There's going to be an election in this country by 2025, and by this rate, it looks like Canadians might not have access to this, which your government is still committed to doing. So what's the time frame?
Let's be very clear. There's going to be in the coming days legislation. That legislation is going to exactly talk about what our plan is to deal with the fact that the system isn't ready at this point in time. What we've said all along is that it's essential that this be done right, and that for somebody who's trapped in decades of suffering, that yes, they be given of their own volition and choice after decades of trying everything. If they believe there's nothing left for them and they're in an absolute state of mental torture and hell, then they want to be able to make that decision. But we have to make sure that it's limited to those circumstances and that we have proper controls and that the system is ready. So, we're being deliberative. We're working with provinces and territories and with experts to make sure the system is ready. There will be legislation in the coming days to talk about how much time we feel, based on the conversations that we've been having, is required. We're just not in a position to be able to say that at this time.
Right now is outpacing other countries in a surge of medical assistance and dying deaths. I mean, does that play into your decision to delay? Are you concerned about how high the numbers are of people who are using this?
Well, let me be direct and very personal. My uncle very recently got a terminal cancer diagnosis and made a decision to access MAID. And he made that decision because all that was left to him was suffering. And so he made a decision to end his life on his terms. Over 96% of people who access MAID use it in such a fashion. It is an end-of-life decision. They are not facing a circumstance where their life will continue. And so when they get a terminal diagnosis, most often it's a cancer diagnosis, they make the decision that they want to end their life on their terms and in their way, and not to succumb to the worst and most terrible, painful parts of that disease. And so, when we see those numbers, I think it's important to remember that's 96% of the people that we talk to, they're making that choice about the few days, scant days that are left to them. And so that's what's happening in our system. And, these are tough conversations. We're all going to die. How we die is something that terrifies each and every one of us. But we need to have mature, non-partisan conversations about that. And that's what Minister Virani and I are both trying to do. Okay, last question.
What do you say to the people who are waiting for March 17th to access MAID, and now you're saying you don't have a timeline for when they might be able to? What do you say to those people?
Well, first of all, I can't give you a timeline yet, or them a timeline yet, just because we haven't introduced the legislation. The legislation will be introduced in days, and so they'll be given more clarity in a couple of days. Secondly, I would say and it's a very small number, but it is there. There are people who are trapped in absolute mental torture. I cannot imagine their circumstance. I have not had the opportunity to directly talk with such individuals, but I have an opportunity to talk with their physicians, and it's an absolute nightmare. And it's horrid that anybody could be in that circumstance. It's why working with provinces and territories, and Minister Virani and I working with Minister Sachs, bringing all the tools we can at our disposal to help those who are suffering with mental illness, and to try to bring relief in any way that we can. That's the focus of our system. In the very, very rare instances where there is no help and somebody reaches that end of journey of trying everything, yes, this is going to mean those individuals are going to have to wait a little longer. But I think those individuals would understand that in the broader need to get it right and make sure our system is prepared, that's a sacrifice we must make.
Vous avez dit,
Thank you so much.